This is an official legal disclaimer. The content on Awaken Wellness is for informational and educational purposes only. It is not intended to be substituted for professional medical advice, diagnosis, or treatment. Nothing shared on this show should be taken as personal medical advice. Always consult your physician or qualified healthcare provider before making changes to your medications, supplements, or treatment plan. Never disregard professional medical advice or delay seeking it based on something you heard on this podcast. Welcome in. It is great to have you here. Today on this episode, we are going to speak about PPIs. Any idea what a PPI is? A proton pump inhibitor, commonly known as my heartburn pill. If you've been to the doctor and told your labs were normal, that everything was fine, but you go home feeling awful and defeated, this is a show for you. I'm Tanya Candee, registered nurse and health coach. I too am a recovering sick person. I spent the majority of my adult life on a prescription, doing everything my doctor told me to do, and getting sicker and sicker. In 2019, I walked away from traditional sick care system. After realizing that the root cause of my autoimmune disease and my chronic pain wasn't a missing prescription, it was me. And I had the power to make a change. Now here's what I want you to know. I'm not anti-doctor, but I am pro-choice. I want you to know that you have options that your doctor probably didn't mention. And you have every right to ask better questions. On Awaken Wellness, I dig into your root causes of why you're still struggling and what you might actually do about it. No fluff, no overwhelm, no pill for every ill, just real common sense, root cause conversations, and a tough, love yet compassionate way. By the time we're done, you'll be awakened. Now, let's get into it. All right, so your heartburn pill, is that you? If you're listening, it's so common. Heartburn pills. Other names for them over the counter is going to be protonic. No, sorry, that's not right. Protonics is prescription strength. Over the counter is omeprazole or Prilosec. Even Nexium now is also over the counter. These medications are widely used for heartburn. What is heartburn? Heartburn or acid reflux, kind of that burn literally that's coming up your throat, making you go it can cause that saliva when that that is your body making more mucus trying to coat and soothe that throat. So the need for these medications can be real. They can be bought at any store, Walmart, big box store, grocery store. They can also be prescribed for extended use by your physician. So again, we're not wanting to argue who's right, who's wrong. I just want to tell you my story with PPIs. So the majority of my adult life, I was on a proton pump inhibitor. Over the counter use, doing things my own way was every day still having breakthrough heartburn, even while taking a PPI, proton pump inhibitor. At that time in my life, I was not asking the right questions. So if you're listening here today, that is my whole goal of coming here, is to help you trigger your mind and ask better questions. So I didn't really ask why. Why am I having all this heartburn? In my early years, I had had a gallbladder attack, had some testing, and it, never resulted in surgery. Things kind of went on my daily life. I had a very stressful life, my 20s and 30s, just like you, right? I was nobody special. My stress was not more special than somebody else's stress, but I ran on Diet Coke, stress. I worked 2 jobs and always had heartburn. So I had this episode in my 30s, I would say, probably mid 30s, where as a nurse, if you've ever had a patient who has a GI bleed where they've had a bowel movement that has digested blood in it, it's a smell that you don't forget. You know what that smell is. I myself was, just doing life, raising 2 kids by myself, doing 2 jobs, working and living my best life, right? And I knew I had one of these digested blood bowel movements, but it was just one and it didn't happen again. So I don't know if you know any nurses, but we tend to be the worst patients, right? We're so stubborn. We know enough to get us in trouble. And then when it comes to our own health, who wants to slow down and take care of these things? So the weeks went by and nothing else happened again, but always had lived with this chronic heartburn, even on a PPI. And then I had an episode where I was really run down, really short of breath. When I finally went in to get checked out, my hemoglobin was below 7. So my doctor said, yep, you're going to be inpatient. You're going to get some testing done. So I got the EGD, I got the colonoscopy, and yes, I was not a very good patient. All to find out that I had chronic gastritis. Now, what does that mean? Itis in my gastrointestinal system, which led to microscopic bleeding. At that time, also being in my mid 30s, having cycle changes, heavy periods, probably weighed in on this low hemoglobin. And I was just amped up. At that time, I was put on Protonics, which is a prescription PPI. And I just how things are, and I'm not blaming anybody. As a nurse, I know that these conversations we don't have enough time for. We don't ask enough questions as patients, and basically we don't want to change, right? Even if my doctor would have told me then, girl, come on now, you got to stop drinking Diet Coke, like this stuff is burning out your stomach lining. Would that version of me have listened? I don't know. I don't know. But I do know, even during this period of time, I honestly don't remember what the timeline was, but I was anemic because of the blood loss. I had the pyrexia where I wanted to eat ice all the time. I would go to the grocery store and buy a bag of ice and literally chew through it in a couple of days. Now, I just kept doing life. I just ate the normal American diet. I just drank Diet Coke every day and I worked. and that was what I did. Even still having breakthrough heartburn, would take antacids on the side. Now I did get myself off of the Diet Coke. So thank you to my good Lord who still gives me some intuition, some common sense, had gotten myself off Diet Coke. And we'll do another podcast on that my absolute deliverance from Diet Coke. If you hang out with me here on the podcast, I'll be throwing my religious, not so typical religious views in as we talk things out. But I straight up had a Diet Coke addiction and a stress addiction. I'm not gonna lie. I've always been a little overweight, always lost and gained that same 20 pounds throughout every decade or so in my life, redoing that same thing, right? But all of these things are connected, and it will be multiple episodes where I'll tell you what a dumbass I was in my 20s and my 30s and how I nearly destroyed my health all by myself. So I am absolutely not blaming any doctors. I am not blaming the medical system. I take responsibility for not informing myself, for not asking better questions, for just being a programmed idiot. Honestly, being a programmed idiot, not questioning any of it. Now, I applaud anybody out there listening who is in their 20s and 30s, who is doing things more natural, who is doing things more holistic, who is smarter than I was at that time. Like, I am so happy for you. I want to hear from you. I want you to find me on Facebook and get in the comments because, like, you are my people. I am so proud of you. When I was sick, when I was chronically on a PPI, I also had so much pain in my body, so many fibromyalgia symptoms, which is a little bit tricky to diagnose, but the pain everywhere. We'll do many episodes on that. I later in life, if things spiral, right? Right now, we look for root causes. And when we talk about root causes, like stomach acid is a big one. And I just want to say, loud, proud, big, and bold, the good Lord designed us to need stomach acid, not PPIs, not proton pump inhibitors. Stomach acid is a key to our health. I tell a story frequently about if we could see on the inside of our body like we can see on the outside of it, we would treat it so much differently. In my humble opinion, from what I know now, what I've walked through in my own healing, stomach acid is your body's first line of defense, just like your skin. Your skin is defense against everything that we do not want inside of it. Our stomach acid is the same. When we take away that acid, even when we eat fruit that isn't washed good enough, or pick up something off the floor and eat it, or whatever it is, that stomach acid is there to neutralize pathogens coming in your mouth from the food you drink, from the water, or sorry, the food that you eat, the water that you drink, right? This stomach acid has a huge role in your health. When you take it away, bad shit happens in the rest of your body, in the rest of your digestive system. Now, all of this that I've said so far is complete Tanya-isms. This is about the journey that I have walked out. I will give you some facts, I absolutely will, but that part of it was my health journey, my experience. Now, with that gastritis, and then just being put on a stronger proton pump inhibitor, praise the Lord, I did figure out how to get Diet Coke out of my life. Now, am I saying that everybody out there that drinks Diet Coke is doomed to have gastritis? No, I'm not saying that. But it was a big part of what wrecked me, a really big part of what wrecked me. So now I had gotten myself off of the PPI. I had gotten under control, but I was probably on it for 15 years before I was able to get off and get things under control. And even now, I do have a hiatal hernia. We'll do episodes about that and my belief and different ways that that can be handled. So, throughout my life, the heartburn will come back. It is a constant having to stay smart, stay in tuned, and stay on a healing path. I can mess that up and go backwards just as easy as going forward. So, of course, that's the sucky part of any good and bad habits. The bad habits, boom, they just come like that. The good habits, that habit stacking and finding and seeking health is something that we have to wake up every day and recommit to. It's a big deal. So I do want to throw some facts out here in this episode. We're going to try to keep it to about a half an hour, but we're not going to be done with this subject, okay? The back of the box of omeprazole or Prilosec plainly states that you should not take that product for longer than 14 days. And it should not be used more than every 4 months, unless directed by a doctor. So now there are plenty of doctors that keep people on that 24/7, one pill every day, forever. They'll keep refilling it forever. The box says 14 days for a reason. Omeprazole used to be a prescription. It went over the counter in 1989. Oh, no, sorry. Get back to my notes. It was prescription drug. It came available in 1989. It went over the counter in 2003. So, sorry about that. So, that's a long time that this has been within reach in people's cabinets. Now, back to, here's what I want you to understand about how widespread these PPI use is. Proton pump inhibitors like omeprazole, Prilosec, Protonix, Nexium, Prevacid. They're one of the most prescribed classes of medication in the United States. In 2023, omeprazole alone was the 10th most commonly prescribed medication in the United States, with more than 45 million prescriptions written in a single year. And that's just the prescriptions. That's not the people who just went out and bought it themselves. Globally, it's estimated that 113 million PPI prescriptions are filled every year. And here's what the research says about those prescriptions. Studies published in peer-reviewed medical literature found that between 25 and 70% of all PPI prescriptions were written for what researchers call inappropriate reasons, meaning up to 7 out of 10 people are taking the medication and may not actually medically have a justified reason to be on it in the first place. Up to 7 out of 10. Think about it. Fact number 3, what stomach acid actually does. All right, let's talk about it. Because somewhere along the line, we got the idea that stomach acid was the enemy. Now, can people get ulcers? They can, especially if you get some H. pylori bacteria, something, there's a reason for it. There's a reason, right? But for the vast majority of cases, stomach acid is not the enemy. That is, it's not aggressive. It's not destructive. It's not a thing that needs to be suppressed. So I want to challenge your thinking today. Ask a better question. Your stomach acid was put there by design. It has a job. It has several jobs. First, it breaks down protein. Without adequate stomach acid, your body cannot properly digest protein. It doesn't matter how much of it you eat. If you're not breaking it down, it's just going down the toilet. And protein's expensive, right? You just eat a big old steak, but you have no stomach acid. What benefit was it? It just sits and ferments and causes your body to become acidic. Second, stomach acid is your first line of defense, right? I mentioned that earlier. When swallowing something that your body doesn't need in it, like bacteria, parasites, toxins, pathogens, stomach acid is what neutralizes these things before they can go further into your digestive system. Third, stomach acid triggers your whole digestive cascade. It signals your pancreas to release enzymes. It signals your gallbladder to release bile. Every single thing that happens downstream in your digestion depends on stomach acid and its signals. When you take away the acid, none of that works right. None of that happens like it should. Your digestion doesn't just slow down, the whole system becomes compromised. And the longer it's compromised, the further the downstream damage goes. Fact 4, calcium and bone connection. Let's talk about your bones. Because this is the one thing that you really don't hear people talk about. I sure didn't hear anything about it. And I'm over it. I built my bridge. I sound angry, but I'm not angry. I'm good. I'm on my healing path, right? Your stomach acid has a very specific role in calcium absorption. Research published by the National Institute of Health explains it like this. In an acidic environment, the stomach facilitates the release of ionized calcium from the food you eat. That process is what makes it possible for your body to absorb calcium in the first place. No acid, no calcium, no absorption. It's that direct. Here's where it gets worse. When your calcium level drops, your parathyroid gland, 4 little glands in your neck, go into emergency mode. It starts releasing parathyroid hormone to find calcium somewhere. And where does it find it? Research published by the NIH confirms chronic PPI use leads to parathyroid changes that result in increased loss of calcium coming directly from your bones. So your body, because we took away its natural process, you still need calcium to digest, to do all these other things. So because we handicapped your body, now your body has no choice but to go through the back door and rob from your skeletal system to make up for what that medication is blocking. And yeah, the FDA knows it. They approve it, right? It's FDA approved. We only want to deal with things that the FDA approves. It's very much approved. In 2010, over 15 years ago, the FDA issued an official safety warning. You might find it on the back or the package insert about the increased risk of spine, wrist, and hip fractures with PPI use. Right there on the information that was handed to me, that's been handed to you. It's up to me to read this. It's up to me to make an intelligent decision or ask better questions. The risk even goes up in older adults. The risk gets higher the longer you take it. So, when was the last time your doctor mentioned this to you when you went in and complained about heartburn? Fact 5. The nutrient depletion cascade. Calcium is not the only thing a PPI blocks. Research shows that long-term use is associated with the malabsorption of magnesium, B12, and iron as well. There's a lot of ladies that come through Awaken Wellness with low iron, B12 that's high in their blood, but their body's not using it, low magnesium, and a lot of times on a PPI. Not always, but a lot of times. Let me tell you what low magnesium looks like. It looks like pain, pain, muscle cramps, fatigue, anxiety, heart palpitations, and trouble sleeping. Most people, PPI or no, are magnesium deficient. Let me tell you what low B12 looks like. Brain fog, fatigue, numbness and tingling in your hands and feet, neurological symptoms that your doctor may be chasing with a completely different workup or sending you off to a different specialist, right? Low iron, chronic fatigue, hair loss, feeling cold all the time. Now, here is my question for you. How many of those symptoms sound familiar? And how many of them have been investigated by your doctor? Not as a side effect of that PPI that you're refilling every month, but as a brand new separate problem. Checking into your thyroid if your hair is losing and you're cold. That leads to a brand new separate prescription. This is what we mean when we talk about a pill for every ill. Fact number 6, the gallbladder question. Now, I gotta be careful here because what I'm about to share is not saddled in science. This is a little bit more Tanya's professional opinion, what I walked through with my own health and questions that I have. Now that I'm gray-haired and wise enough to ask better questions, my question is, what's the connection between being on a PPI and having gallbladder dysfunction? Maybe gallstones, maybe your gallbladder's already gone. I don't know. Seems to me like it's pretty relevant. If we know that suppressing that stomach acid, that system's not really firing right, and your signal's getting off, that gallbladder is a gland. It's not just something to casually have removed. It is the shot caller in your digestive system, right? It tells your other organs what you just ate. It sends a signal. It's like the organizer of the whole team. So, asking better questions. There was a study published in a surgical endoscopy found that subjects taking PPIs had reduced gallbladder motility, meaning the gallbladder slows down, it doesn't empty the way it should. And when bile sits in the gallbladder too long, that is one of the conditions under which stones can form. In a separate data point between 1988 and 1920, gallstone disease in the United States nearly doubled. So that's pretty significant, right? That whole time kind of lines up to when this medication really started being used, right? Gallbladder surgery nearly doubled in that same period of time. That proton pump inhibitors went mainstream, right? Remember, that was 1980. So I'm not telling you that it's the cause. Correlation is probably the better word. I'm not saying causation, but I am asking a better question. I'm sure I'm not the only one asking it, but I do wonder. Fact 7. Okay, we're going to be here longer than 30 minutes. The stress response and overdrive. So this last thing we're gonna leave you with the facts, and it comes from me sitting down with lots of women just like you, and my own personal experience as a patient. If your body is producing too much stomach acid, there is a reason. Why? We ask better questions. Excess acid production is a symptom. It's not the problem. It's a symptom. And it's not random malfunction. It's your body responding to something that it doesn't like, that it's trying to neutralize, that it's trying to get rid of. Maybe it's a food. For me, black pepper and dairy, huge triggers. My body is on the no thank you. Like, I can still trigger heartburn. Boom, just like that. Throw me some black pepper or something with it on there, or dairy, either one. Other things, stress response. So stress itself actually shunts your stomach acid production. Other things like infection, like H. pylori or other bacteria, or people will have like food stuck in their stomach that their body cannot break down, that is not going anywhere. These things happen. But when you suppress that signal, that proton pump inhibitor, that is not fixing anything. You're silencing an alarm, but there is still a fire. Like, your house is still on fire, but you just refused to let the fire company come and fix the problem, right? Personally, and what many of my clients have experienced as well, it's a horrific feeling when you have no stomach acid and you just start eating or taking supplements. People with low stomach acid have a really hard time with supplements. They make them feel yucky, they make them feel nauseous. It's because when there's no stomach acid there and you dump into it food or supplements or whatever, all of a sudden your body, that stomach, has to go into overdrive to try to compensate. On a PPI, we took that away, right? So your symptoms, the burning might be down, but so is your digestion. How is your body supposed to do this job without the tool? People will feel bloated. They'll feel discomfort. They will have more IBS symptoms, more constipation, more undigested food in the toilet. Does that sound familiar? This conversation is not a coincidence. What is your body trying to tell you? The symptoms that you experience in your body are your body's communication language. It's not trying to hurt itself. Your body will never try to hurt itself. It's only a product of the environment in which you expose it to. Your symptoms are your body's language talking to you, trying to tell you something, right? So, what is your root cause? If you're a chronic heartburn sufferer, maybe it's a hiatal hernia. We'll talk about that in another episode. There is management there, right? You can do life with a hiatal hernia and without a proton and pump inhibitor. You have to do some things that don't come natural. You have to do some things different. So, this is not about throwing your medication in the trash today. This is not taking things into your own hands. This is about you going to your doctor and asking better questions. What can you do differently? In my practice, we do a lot of food sensitivity testing to help your body communicate, to tell you in black and white what it would be very appreciative of if you stopped eating it. And that is quick relief, big time relief, when you know just what to say no to, right? If you just want to guess, try omitting pepper, black pepper, red pepper, cayenne pepper, all of them, and see. Take the pepper off your table and see if your heartburn symptoms doesn't quickly improve. We know that going to bed on an empty stomach is preferred to your gastrointestinal system. Your digestive system would also like to rest at night, would also like to sleep at night. It will be most active between like midnight and 3. Your liver, your digestive system wants to cycle, wants to clean itself. You'll sleep better. You'll have less reflux. My other personal one is dairy and gluten. So no, nobody wants to be dairy-free. Nobody wants to be gluten-free. And probably nobody wants to be without black pepper in their shaker on the table. But if you do want to be without heartburn, if you do want to do life without a proton pump inhibitor, I think it's worth a try. So let's wrap up with a couple of questions that you can take to your medical provider. Number 1, why am I on this PPI? And what is the actual root cause of my stomach acid? Question number 2, how long do you plan on keeping me on this medication? Question number 3, please check my calcium, magnesium, B12, and iron levels while I'm on this medication. Maybe that wasn't a question. Maybe that was just a thing you want to make sure they do. Number 4, what would it look like to address the underlying cause instead of managing the symptom? A good doctor is going to be excited to have this conversation with you, is going to be excited that you're willing to put in some effort and be in control of your own health. Now, on the next episode, we are going to talk some more about this subject. We're going to look at gut health a little bit differently. I'm going to show you some things visually. You'll have to find me on Awaken Wellness YouTube to be able to see that. Things that changed everything for me. So yeah, during this podcast, it will broadcast live on YouTube. So make sure you go to Awaken Wellness TV, like and subscribe so you get those notifications. You're not going to want to miss it. So, if anything that I just shared with you hit close to home today, if you've been on heartburn medication for longer than 2 weeks and nobody asked you why or when you were coming off of it, I encourage you just to do something simple to take a step in the right direction of taking control of your health. I've got for you a 5-day challenge. I just call it Fresh, 5-day Fresh. And I'll link it in the show notes for you. You can do anything for 5 days. It's not overwhelming. It's not easy, but I know that you can do it. It's just getting back to some basics so your body can do what it was designed to do. You can do it.
All right, that's all I've got for you today. If any of this hit close to home, I want you to remember you're not crazy. Just because your labs say normal does not mean everything is fine. And you have options. Number one, start asking better questions of the doctor you already have. If you're ready to take the first step here, check out my 5-day free Fresh Challenge. The link is in the show notes. Just 5 days, no overwhelm, get you back to the basics. You can do anything for 5 days. And if you found value here, please like and share and leave a 5-star review so this show can touch more people who need it. Every review helps us reach someone who is still sitting at home thinking they're crazy. You can also find me live on YouTube. Search Awaken Wellness TV. Hit that like and subscribe button so you make sure you get notified when this show goes live. I'm Tanya Candee, and this is Awaken Wellness.